You did not spend years building a critical care practice just to spend your days chasing payer denials and untangling modifier disputes. But right now, the business side of medicine is actively breaking practice finances. Hospitals and health systems lost a record $48.4 billion to claim denials in 2025, a 25% leap. Broken down, we see an 11.6% initial denial rate. Roughly 1 in 9 claims is rejected before your team can follow up. Dealing with this requires massive operational drag. Physicians and their staff now spend an average of 13 hours every single week, managing around 40 prior authorization requests per doctor. These numbers show a system operating under severe friction. Routine administrative tasks are now primary drivers of both practice insolvency and widespread physician burnout. And if you manage a critical care practice specifically, you are uniquely vulnerable to this revenue leakage. This graphic illustrates the strict structure of time-based CPT codes 99291 and 99292. A single documentation gap or a modifier mistake triggers an instant audit or denial. When those rejections happen, the penalty compounds. Reworking a single denied claim costs your practice between $25 and $117 in administrative overhead. This brings us to the staffing problem. Generalist billing teams without specific critical care training frequently fall into what managers call the documentation denial spiral, driving up days in accounts receivable. Retaining that staff is expensive. Replacing one front office billing employee costs between $9,000 and $12,000 in recruiting, onboarding, and lost productivity. You are left paying premium salaries for generalist in-house teams that actively leak your hard-earned revenue. To survive the 2025 landscape, smart practices are abandoning that structure entirely and adopting a highly streamlined operational model. They're outsourcing their revenue cycle to AAPC and AHIMA credentialed specialty teams who work natively inside the practice's existing EMR. There is no screen share lag, no exporting massive files at the end of the day, and zero disruption to your current workflow. The team simply operates within your system. These human experts are supported by specialized AI-augmented workflow tools. Here we see how the AI smart routing functions. It audits the claim and flags the bottleneck before the submission gate, preventing the denial spiral before it even starts. By combining credentialed specialty experts with AI assistants, practices shift their revenue cycle entirely, moving from a posture of reactive defense to proactive capture. Getting this operational is a rapid, predictable sequence. A practice fully integrates this model in just 14 days. Step 1 is the kickoff call. This is where we meticulously map out your practice's specific payer mix and billing history. Step 2 establishes a secure connection to your EMR. This happens within 24 to 48 hours and operates strictly under SOC 2 Type 2 compliance. Step 3 is team onboarding. Your new credentialed staff align precisely with your critical care workflows and specific documentation roles. Step 4 is Go Live, featuring daily quality reviews to immediately catch and correct any payer-specific nuances. Finally, Step 5 delivers weekly KPI dashboards directly to your C-suite, providing continuous oversight on accuracy and turnaround times. This highly structured sequence entirely eliminates the chaotic 2 to 4 week dead zone that usually plagues practices when an in-house staff member quits. Let's look directly at the pure math comparing these two models. On this scale, the left represents the in-house generalist model, $55,000 to $75,000 annually, plus a steep turnover penalty. On the right is Staffingly's integrated specialty model. At $399 a week, it totals roughly $20,000 annually, a massive cost saving. And at that lower cost, you secure premium performance. Staffingly holds an error rate strictly below 1. Surviving the future of healthcare requires letting specialized experts handle the administrative complexity, so your practice can focus entirely on patient care.